So a normal day, we would go in, meet all the nurses from the night staff and do a handover, just to keep us up to date with what's going on the ward and what sort of patients we have. And then we'd go around in the morning, greeting all the patients, introducing yourself, and do the daily washes and get them ready and set up for the day.
We set up the clinics, which can involve getting different bits of equipment out depending which clinic you're allocated. And then once the doctors arrive, we take them to the room, make sure they've got everything they need, and then the patients start arriving. So we welcome the patients. We're obviously often the first people they see. Sometimes they can be a bit nervous, so it's important to just kind of be welcoming and smiley, introduce yourself, and then basic observations before they see the doctor, and then support them as they're in the consultation room as well. Sometimes they might be having examinations and we act as a chaperone and listen as well and just make sure they do understand the information that the doctor's telling them.
You could be doing breastfeeding, you could be doing cup feeding, you're assisting patients, section mums to the toilet, removing catheters, taking bloods, and making sure you do all the discharges, discharge talks, making sure that all the beds that need to be done are done and the 10 o'clock obs are done as well. But you're trained in all these aspects as well, so you get into a little routine yourself and you know exactly what to do after that.
So I work in acute medicine. It is a female short stay ward, so we do get a variety of different patients, dementia patients, end-of-life patients, quite a few mental health patients, so the variety is there for sure.
Because it's main outpatients, it covers all sorts of specialties. So there's clinics from like rheumatology, dermatology, neurology, all sorts of different areas, and we cover all of them as CSWs.
We deal with patients that have come from A&E, that come into clinic with things like chest pain or deep vein thrombosis, and we basically triage them. We do a set of observations, do their bloods, and then let the doctors see them. When we're ward-based, we get surgical patients, medical, elderly patients. We get quite a huge mix.
A good day looks like when you've got enough staff on the ward and you can give a one-to-one care to each individual patient.
If the patients get a good night's sleep and everything's run smoothly, I think the next day really goes well.
Together.
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 Together, we thrive.